welcome to our webinar tonight on thyroid disorders. We find that the thyroid is probably one of the most common things that people come in with questions about, and there's a lot of information that goes into really deciding what we need to do to take care of the thyroid. So we hope this provides some good information for everybody, and looking forward to helping y'all hopefully answer some questions that we might have. So again, this is all about the thyroid. A little about myself. I'm a board certified family practitioner, and we work here at Vitality Natural Wellness, which is more of an integrative medicine practice. We have 2 practice locations, one in Mansfield, Ohio, and one in Powell, Ohio. And really, Vitality was created, what I consider, out of necessity for the changing medical environment. I had a traditional practice for quite some time, and what I noticed, I was spending less and less time with patients, and I was spending less and less time talking about options for healing people, and really what are options outside of prescriptives. So out of that whole mess of what I consider medicine right now, Vitality was born, and we are just really, really excited about the ability to restore health and get back to what medicine is really all about. So let's get to the good stuff. Again, we see so many patients who come in and they commonly say, I have every symptom on a thyroid questionnaire online, but then I get my blood work tested and they tell me that everything is fine, when in fact everything probably is not fine. So we're going to dive into those basics of what the thyroid is all about. Change the screens. Okay, so I want everybody to kind of take a good look at this. Is the thyroid. It sits right near the Adam's apple, kind of sandwiched right around that area, and it lies right on top of your windpipe, which is your trachea. So it's a squishy kind of gland, usually pretty small in size, but it is absolutely incredible. I consider it like the supervisor to the body. It affects every single organ and every single cell that you have, and all of those cellular functions. So the thyroid gland is crucial to your body working properly. One of the analogies I like to use is if you consider your body as a factory, and this thyroid gland is kind of like the supervisor. So it tells your body whether to speed up or whether to slow down. And it does that by sending out hormones. And the thyroid typically produces 2 main hormones. It does have a couple of other ones, but we're going to focus on the thyroid hormones tonight. Those 2 particular hormones are kind of like employees in your factory. So say you have this big factory and you have multiple types of employees. You have the really, really amazing employees. They never take a day off. They never take breaks. And that's actually your T3 thyroid hormone. T3 thyroid hormone comes from the thyroid gland, and it's your amazing, super powerful and strong thyroid hormone. And then in your factory, you also have those workers that maybe take lots of time off, they take lots of breaks, sometimes they don't show up. But if you didn't have them, you would have even bigger gaps in production. But those kind of weaker employees, or that weaker thyroid hormone, is what is also known as T4. So those are the 2 main thyroid hormones that the thyroid gland produces. Again, those thyroid hormones are crucial for regulating pretty much every function we have in our body. When we talk about the different types of thyroid problems that we have, there's an overactive thyroid and an underactive thyroid. We'll just touch base on overactive thyroid because we don't see that as often, maybe 5% of the time. An overactive thyroid is a thyroid gland that's producing way too much thyroid hormone. So everything is really, really geared up. And when you think about symptoms from that, it might be nervousness or anxiety, rapid heart rate, you can have diarrhea, excess sweating, sometimes we see weight loss and sleep problems. So think about your body just completely geared up, and that's hyperthyroidism. The most common cause of the overactive thyroid is Graves' disease, and Graves is actually an autoimmune disorder. Now, we deal with autoimmune disorders a little differently here than maybe other practices do, but that's for another conversation. So Graves' disease is the most common autoimmune hyperthyroid state, mostly found in women, and tends to be more inherited. You can also have what's called a multinodular goiter, and that's where you can have kind of like the lumpy thyroid with lots of cysts in it, and those cysts can be functional, and by functional means they're spitting out a lot of thyroid hormone, and that can also that can also cause a hyperthyroid state. Sometimes you'll get that with viruses, sometimes you'll get that with certain infections or illnesses. But now I really want to kind of jump into the good stuff about what we deal with regularly, and that's going to be your underactive thyroid. So when we're talking about an underactive thyroid, that's called hypothyroidism, and that's when your body lacks sufficient thyroid hormone. So since the main purpose of the thyroid is to control the body's metabolism, it's certainly understandable that so many people have those symptoms and complaints when they don't feel well. That slow metabolism affects just about every aspect of your body, and you can see from our list, these are just some of the things that people will notice. There's approximately 10 million Americans that have hypothyroidism, and we know that about 30% of women actually have an underactive thyroid. So it's a very, very common problem. So what are the symptoms? Let's take a look. Fatigue and weakness, weight gain or difficulty losing weight. We had a patient just this week who came in, and she's doing everything right. She's eating great, she's eating clean, she's cutting out her simple carbs and sugars, really doing a fantastic job, trying to exercise, and absolutely nothing is happening. So she said, I've had my thyroid checked and they tell me it's fine. So again, we took a look, and things are not always what they seem. So some people say, well, how do I know if my thyroid is overactive or underactive? And just imagine overactive thyroid means everything is dialed up. So that anxiousness and rapid heart rate. Underactive thyroid is you just have no get up and go. Everything is slowed down. Your hair doesn't grow, your skin is dry, maybe your bowels aren't moving right, energy is dropped, you've got brain fog, and you just can't quite think as well as you would like to think. Those are all things we look for when we're looking at hypothyroidism. So this is where I feel vitality is very different from many medical practices. If you feel like you have a thyroid problem and you ask, well, why do I have this thyroid problem? If you're ever told it doesn't matter, we treat it all the same, then I would keep looking, because getting to the root cause is always the issue, and the goal is not to keep someone on medication forever, it's actually to correct the problem. So we're going to look at a couple of the causes of thyroid gland to not work right. The first one is autoimmune. The majority of cases of hypothyroidism or underactive thyroid are because of an autoimmune disorder, typically known as Hashimoto's thyroiditis. So your body is actually creating antibodies, which are proteins, that attack the thyroid gland. And just like if you had a bully in school picking on you every day, you're not going to function well, right? And the thyroid is the same thing. If it's being picked on all the time, it is not going to function properly. We have most of our inflammatory antibodies are produced in the gut. And so we really focus a lot on gut health when you have an autoimmune thyroid issue. Now, one of the next main causes of a thyroid gland not working properly, say somebody does not have an autoimmune thyroid problem. Well, why then is their thyroid not working right? So we look at nutrient issues, such as nutrient deficiencies. Your thyroid gland requires certain ingredients to make thyroid hormone. So we think of zinc and selenium, iron, magnesium, and of course iodine. Those are all critical, and you have to have them. A lot of people's diets are not varied enough to get those nutrients, and we find nutrient density in food is very different. So we're growing foods in depleted soils, and then those nutrients just don't make it into our foods. So sometimes we have what I call the Sam's Club effect with our diet, and you go to Sam's Club and you always buy the sweet potatoes, the avocados, you buy your almond milk, and you buy some bags of salad. Like, people get the same types of things when they do their shopping, and that variability just isn't enough to give us the nutrients we need. So it's really, really important that we try to get our nutrients in. And it's not always difficult, and it's not like people have to take tons of supplements for that. We just need to vary our diets a little bit. And if you find, for instance, selenium's required for thyroid hormone, you can simply get your daily supply of selenium and 3 Brazil nuts. So we really try to work with you and educate you on how you can get those nutrients into your body so your thyroid can function properly. Now, here's the other question. What if you're actually taking in everything? You're taking in those nutrients. Maybe you're taking some supplements and you're taking some thyroid support and you're getting everything you need. Why then would your thyroid not work right? Well, this is the other thing that we commonly see. You're taking the nutrients in and your gut is just not absorbing things. So we see those absorption problems, and when we look at that, um, we start honing in on digestive issues. Do you have any bloating or gassiness? Do you have any food intolerances or sensitivities when you eat different things? That focus on the gut is crucial. When you think about your gut lining, the outside wall should be shiny like a hot dog casing. So nice and shiny. Fluid can get in and out, but not very easily. That's a normal gut wall. Well, what happens is after exposure to things like different medications, birth control, antidepressants, antibiotics, steroids, and lots of different chemicals that we're exposed to, that gut wall, instead of being nice and shiny and keeping things in and out like it's supposed to, becomes very porous. That's like spongy. So nutrients, instead of staying where they're supposed to be and getting absorbed, pass through, and then your body will see those as abnormal and try to fight those. We see lots of food sensitivities then developing. So some of those symptoms are a key role. You may be taking in the nutrients, but if you're not absorbing them, your body will not do what it's supposed to, which is make thyroid hormone. And one of the last areas, which is also very key, are adrenal problems. And your adrenal glands are these little tiny bean-like glands, and they sit on top of your kidneys. So yes, the kidneys are very, very far away from the thyroid gland, but they intimately communicate back and forth. And having those two glands work together is also critical to controlling our energy levels. So what can happen is we all know people, or maybe personally, that have been through some incredibly stressful events in their life, typically if they're a little maintained. So whether it's health problems, hospitalizations, major surgeries or injuries, or even being a chronic caregiver for a parent or a sick child, those high levels of stress, people will say, you know, they get through it and they get through it and they function and they work and they take care and they try to recover. And they do this for a period of time. And when it's all said and done, all of a sudden they just crash. And they wonder, how in the world did I get through all of that? And now when the stress is not so bad, I can't even function. So your adrenal glands are those little glands, and they put out cortisol, which is a stress hormone. It acts like a steroid. So it gives you that energy to keep going and keep going. Well, your adrenal glands can't do that forever. And so they tire out, or what we experience adrenal fatigue. And so it really needs, the only great way to restore your adrenal glands to a healthier state is to rest them. That culturally doesn't always fit for us. We can't just say we're going to take a month off and go on vacation. So they try to slow you down. Well, the adrenal glands can try to slow you down and you don't feel well, but they will intimately communicate with the thyroid, the adrenal glands will, and tell the thyroid gland, quit making all of that really awesome T3. We need to slow her down so she can rest. And that is exactly what happens. So really paying attention to people's stressors and their history and what other symptoms they have is crucial in really determining what is happening with the adrenal glands. So when we look at, well, how in the world are we even determining if somebody has hypothyroidism? A lot of it is history. So we talk to patients, we find out how they're feeling, what kinds of different systemic symptoms they might be experiencing, and then we use some lab work to really be more confirmatory in what's happening. So there's 4 main things that we check on screening lab work. And again, this is more screening, and it helps guide us into what might need to be done next. The first one is free T3. The reason it's free T3 is it's kind of like if you imagine a couples dance. Okay, say you're a single man or a woman and you go to a couples dance and you're looking for other singles, right? If you find a bunch of people in couples there, there's really nobody else available. Well, free T3, or those singles, are the only ones that are actually able to do any work. So free T3 is very critical. Free T4, that's the weaker thyroid hormone, also critical to know what levels we have. TSH is called thyroid stimulating hormone, and it actually comes from the brain. So if we go back to that analogy of your body as a factory, think about you have You have the floor where all of the employees are, all those thyroid hormones. You have all the lines with all the production happening. Well, imagine on the second floor, really, really far away, you have the boss, and that's where he or she is sitting. And she's so far away that she really can't tell who's doing what. She just sees activity. Well, that's TSH. TSH is a gauge of how much thyroid hormone is circulating through the body, but it doesn't tell us, is it the good stuff or is it the weak stuff? So that's why we never treat based on somebody's TSH level. It's a level that we do have to monitor, but it is far from being diagnostic. That is also commonly what people will say when they go in and they get their blood work tested. Well, my thyroid is fine. The TSH might be okay, but you might not have any T3 floating around. And again, the T3 is mostly responsible for how your system is actually working. The next we have TPO, thyroid peroxidase antibodies. This is one of the biggest markers we have for Hashimoto's. Now there's actually another autoimmune marker, but we typically don't check that on the original screening. Sometimes we're led to dig into things a little deeper, but these 4 tests are what everybody should have if you're truly looking for a thyroid problem. All right, so some underlying issues. This is an interesting one. We've talked a little bit about gut permeability issues such as leaky gut. Food sensitivities can cause big problems when we're trying to work with a thyroid. Nutrient deficiencies, low-grade infections. This is more correlating with some information we've been getting on Epstein-Barr virus, which is a virus that causes mono. There was a study in 2015 that found that 80% of people with Hashimoto's thyroiditis actually harbored Epstein-Barr virus in their thyroids. And people who did not have Hashimoto's, there were 0 patients who had any kind of EBV. So we're finding more and more about that, and it's really exciting in coming up with treatments for people who are resistant to correction. And inflammatory disorders. Anytime you have inflammation in your system, it's always going to be affecting other areas than just one gland because our body functions together. So what can you do? These are some real basic things that you can work on when you have a thyroid issue. You're going to create the best environment for it to function in. So you're going to increase your water intake. That's key. It can help flush out your system and really work to detoxify. If you can add some fresh lemon juice to your water, again, that's a great detoxifier. Cut out all gluten for 2 weeks. We do this in every autoimmune thyroid patient. Gluten is one of the most inflammatory things that we have that affects the thyroid. So we really try to cut that out because, again, we're trying to just calm that down so it has a chance to heal. Start on a good multivitamin. Chances are you're deficient in a few nutrients. We can do extensive testing. However, a good multivitamin that has a nice wide range of nutrients is going to be key. And getting comprehensive lab work. Your body is more than a thyroid gland, and it's more than those 4 tests that I just discussed on. So getting that comprehensive lab work will show us how everything is working together, and we can get your body into more of a state of wellness when we know exactly what we're working with. The last thing I would recommend for thyroid problems is absolutely stress reduction. We know the adrenal glands are going to play a role. And you can simply do some breathing techniques. There's a couple of really cool apps out there. One is called Calm, and there's another one called Breathe. And they literally just send reminders to stop what you're doing, sit back, take some deep breaths, and let your body just calm down. I think so many times we get into that go, 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 go mentality that we really don't stop to think, hey, our body needs to actually calm down a little bit. So those are some main things that you can do just from the initial start of things. So what can you do? So you're wondering, you know, I'm concerned about thyroid problems. I meet all the criteria. I've got some concerns. What do? You have your labs checked. So it's a great piece of information to have when you come in for a consultation because we have a lot more information to go on then. The important thing is to get your answers. If you're not feeling well, you're listening to your body, which is very important. It's imperative that you get answers to what's happening. And if you're not getting the appropriate answers, keep looking. You have to be an advocate for yourself. We want to review those results in detail and really get a good action plan together. There's a lot of things that we can do, and our goal is to get you away from prescriptions and do things as naturally as we can. So it's certainly time to feel better. Everybody is looking for that. We're seeking wellness. And if you're frustrated with your current health or suspect that you have a thyroid issue, then you may be right. We can certainly help you sort that out. And we see thyroid issues a lot. So I'm going to go ahead and stop chatting for a minute. Hopefully that answers some of your questions and gives you a foundation of understanding for the thyroid. And if you have any questions, please don't hesitate to type them in. All right, so what we're going to do, we're going to follow up with a few different webinars. We're probably going to focus on some adrenal issues, and we can get into more specific discussions about thyroid management. We have lots of patients with gut issues and malabsorption problems, leaky gut. So we have a lot of webinars we're going to be putting out there, and we hope that we can get you some great information. If you have any questions about things you'd like to learn about, certainly let us know. We have just one question, and then if I don't see any more, we'll go ahead and wrap it up. Somebody was wondering about what kind of essential oils you can use in thyroid issues. I'm far from an essential oil expert, and we do have some very educated people out there. Spearmint, peppermint, lemongrass, frankincense, those are probably some of the key ones that we look at. But it really depends on what else you have happening. And again, I don't speak to being an oil expert, but I certainly know that they can be very beneficial in a lot of situations, and we have used them in the past. All right, well, we'll go ahead and wrap it up for tonight. I hope everybody has a great evening, and we'll see you next time.